Hello, this is Dr. Laurie Brotto from the Multidisciplinary Vulvodynia program in Vancouver, British Columbia, Canada. I'm here today with Marcy Dayan, who's a pelvic floor physiotherapist in our program. Hi, Marcy. Hi, Laurie. And today, Marcy will be talking about the role of pelvic floor physiotherapy in the treatment of women with genital pain. To begin with, Marcy, can you say a little bit about how pelvic floor physiotherapy might be helpful for a woman with provoked vestibulodynia or genital pain?
Sure, Laurie. When someone comes to physiotherapy, there are really, I guess you could say, 4 different areas that you would be looking at in treatment. I'll talk about those 4 areas generally, and then I'll talk about each of them a little bit in detail. So first of all, you want to really understand about your pelvic floor muscle. You want to understand also where the painful areas are. It's also helpful to understand if you have a pain cycle, there are some things that might increase or decrease your pain. And then the last piece would be figuring out how to put all that information together so that you can have something enter your vagina without pain and hopefully with pleasure. So I'd like to go back to talking about the pelvic floor muscle. It's really, really important for women to understand where it is, what it does, and how to get it to do what you want it to do when you want it to do it. First of all, the pelvic floor has many functions. It maintains your continence, it holds your organs in place, it stabilizes your back and pelvis, and it has a sexual function. It will also tighten if you're experiencing pain or are worried about pain in the area around the muscle. That's a typical, normal thing for muscles in our body to do. If we have neck or back pain, the muscles in that area go spasm, they become tight to protect. If you're having pain at your vagina, or if you're anticipating pain at your vagina, those muscles are going to protectively tighten. So what's really important is that you can figure out how to use those muscles for all those wonderful things that it does. So for example, if you look at sexual activity, your body is on, you're working, you're holding different positions, that muscle is working. And you want to be able to have all of that wonderful stuff stay present and let the muscles at your vagina relax for vaginal entry or for sexual activity. Another area is learning where the painful areas are. A lot of women, when they enter treatment, think that their whole vagina is painful. And it's really not the whole vagina, but there are very, very specific spots right at the entry. It's really, really important that women become comfortable with these spots. They know where they are. They can touch them. This information is really, really useful to help people relax, to be comfortable, and also how to manage those spots when you want something to go inside. Another aspect to look at is the pain cycle. A lot of people, when they come in, again, at the beginning of treatment, they aren't aware that their pain actually changes. In this program, women come in when they have what we call provoked vestibulodynia. So there's only pain when the area is touched. And because people aren't touching at the opening of their vaginas all the time, they might not realize that their pain does cycle. So for example, many women right before the beginning of their period, their pain might be up. Or if they're stressed or fatigued, their pain might be up. So they're very, very specific. They're quite general, and so they do affect, the same triggers will affect many women. But it's important for the women to go through a process to find out which of those triggers affect them individually. And once you understand that area, it's much easier to manage the discomfort. So once you understand about your pelvic floor, you know where the painful areas are, and you have an understanding of your pain cycle, it's really, really helpful to be able to put these ideas together. One of the ways of doing this is starting with using vaginal inserts. So these are a set of inserts, the ones that we use in the program. There's 7 of them. They're made of wax, and they start from very, very narrow diameter up to a larger diameter. And the individual practices inserting these into the vagina, increasing the diameter at a rate and a pace the person is comfortable with. As with all interventions, there's no recipe, and each person's goals, needs, and learning styles are very individual.
Now, Marcy, sometimes women wonder if they're going to be using a technique called biofeedback, and they often have many questions around what that is. Can you say a little bit about what is biofeedback, how it's used in pelvic floor physiotherapy, and is that something that you particularly find useful in women with genital pain?
Yeah, thank you, Lori. I find biofeedback extremely helpful in working with women with genital pain. Biofeedback can be used in a few different ways. Basically, everyone's heard of a heart monitor, and you get electrodes put on your chest, and the equipment takes the information from your heart and puts it on a graph. And biofeedback at the pelvic floor is the exact same thing. When your muscle's working, when it's contracting, it puts out electrical activity, and those sensors pick up that electrical activity and change it into the graph. It does not zap you or give you any electricity at all. All you feel is the sensor going on and coming off. The sensors we use in the program go on the outside. There are 3 sensors, two of them go one on either side of the anus, and one of them goes on the inner thigh. And when the machine is turned on and the woman looks at the screen, it's really, really helpful because often people think that they're relaxing, but they can see from the level of activity on the screen that their muscle function is actually quite high. So it's a good learning tool to try to it's a good learning tool for women to get feedback on what their body is actually doing. And it's also a way that you can practice certain exercises, and you can actually see if what you think your pelvic floor is doing, if it's actually doing it. Because when you want your muscle to contract, you should see the graph go up, and when you want your muscle to relax, you should see the graph go down. Now, actually, sometimes women find that they use a combination of looking at the biofeedback screen and then lying back and closing their eyes and focusing on their body, and then checking back to the screen to see if what they felt they were doing, they were actually doing. So it can be used as an actual tool while they're doing the exercise, and it can be used as a check for them to look back at to see what they've actually done.
So sometimes women wonder if is the goal of physiotherapy to teach women how to strengthen their pelvic floor? Is that a goal of the work that you do?
Not usually. If a woman comes in with issues around her pelvic floor that need strengthening, and she also has pain and has too much tension or tone in the muscle, in that situation, strengthening would become a component of treatment. So some women postpartum that have developed the condition. Generally, it's not part of what we do. The focus is to help women learn how to let go of the muscle, how to relax it. What happens is that women with vulvar pain have learned how to tighten their muscle too much in response to pain or in response to concern or fear of pain. So no, we're mostly focusing on helping people learn how to let that pelvic floor go. But having said that, we're not wanting people to walk around with jelly pelvic floors. That muscle has many different functions, and I don't want people being incontinent. I don't want their organs dropping down. I don't want them to have back pain. So the muscle is used for many, many things. But what's important is that people use their pelvic floor appropriately at the appropriate time. And if you don't want to have any tension at a very specific moment, that you can completely relax the muscle to allow something inside the vagina.
Now, is pelvic floor physiotherapy painful for women, particularly for women that we're talking about here in this program who already report a fair bit of pain with genital activity? How much pain do you, in your experience, do women experience when they're having pelvic floor physiotherapy?
This program believes that pelvic floor physiotherapy should not be painful. Some of it might be a little bit uncomfortable. For example, when the woman's trying to find those painful areas. But again, the concept behind that is not any type of massage or pressure or deep tissue connection. It's just really touching the surface for knowledge, for information. Where does that condition exist in my body? That might be a little bit uncomfortable, but if that exercise really lasts about 30 seconds, and there shouldn't be any discomfort afterwards. Treatments that actually cause pain during the physiotherapy session or after, we don't find clinically that there's any benefit in doing those. It is a pain condition, and one of the things that we know in a pain condition is that if the person experiences pain that flares them up, that actually can trigger that pain alarm and reset their level of pain at a higher level.
Okay. And finally, Marcy, I'm wondering, after women have finished their pelvic floor physiotherapy, how much of their improvement should they expect to maintain over the long term? Or is it the case that once a woman has a genital pain condition that she really should have physiotherapy on an ongoing basis for many, many years?
Well, clinically, what we found and what the goal of the program is to teach the woman the skills that she needs so that she can learn how to manage this condition. On average, I know the program only offers 3 physiotherapy visits, but on average, these skills can be taught to women anywhere from three pretty low end, but anywhere from 3 to 8 visits. Average is 4 to 6.
Great. Thank you very much, Marcy. That was very, very helpful information. Thanks for sharing it with us today.
Thank you, Laurie.